The hip joint is made up of the femur, the pelvis, and soft tissues called the articular cartilage and the labrum. The labrum is a rubbery ring of cartilage that seals the joint. It also acts as a shock absorber. The cartilage and labrum allow the hip bones to move smoothly. If these bones are in an abnormal shape, they can damage the soft tissues, cause pain, and limit the range of motion of the hip. This is called a femoroacetabular impingement, or FAI. There are 3 types of FAI. The first, called a cam lesion, is when the neck of the femur is thicker than it should be. The lesion can pinch the labrum and damage the cartilage. The second, the pincer lesion, is when there's extra bone at the edge of the socket. It can also pinch the labrum. The third type, the subspine lesion, is when an area of bone just above the socket, called the anterior inferior iliac spine, is too large. The labrum and soft tissues can get pinched between the femur and extra bone. Every patient's FAI is unique and can be a combination of these types. We don't know what causes FAI, but it seems to develop as a person grows. FAI is not caused by an injury, but symptoms can get worse with increased activity. To confirm if you have FAI, a doctor can perform a physical exam and use imaging like X-rays, MRI, or CT scan. Physical therapy can help manage pain and improve muscle function, but in some cases, people need surgery. One option is called hip arthroscopy, a minimally invasive surgery. First, your surgeon will make 3 small incisions, 2 for the instruments and 1 for a camera. Next, the surgeon shaves down the extra bone. This smooths out the shape of the joint and improves the range of motion of your hip. And finally, if your labrum is torn or detached, your surgeon carefully stitches the labrum back to the edge of the socket.